Good afternoon. It was a COVID update for the state of Colorado. We have lost 9,652 people to COVID. We know that each one was beloved friend, parent, sister, brother. I express my condolences to all the families who suffered loss. We currently have 1,419 Coloradans in the hospital for COVID right now. That's an increase of 40 from yesterday. There's really no clear pattern over the last week. It's been bouncing up and down. I want everyday Coloradans to know that there is a high level of community transmission of the Delta variant right now in Colorado. So please be careful out there. First and foremost, make sure you're vaccinated. What's remarkable is of the 1,419 hospitalizations, only 16% are among vaccinated individuals. So over 83% are unvaccinated. So even though the vast majority of Coloradans have protected themselves, over 70%, you have that 70% of the population that's only 16% of the hospitalizations, and you have this 30% of the population that's over 83% of the hospitalizations. In addition, the unvaccinated have worse outcomes, even with regard to being hospitalized or hospitalized longer, and have a much higher death rate. So I would encourage you, if you haven't gotten your first shot yet, please get it. Start protecting yourself. If you are fully vaccinated, please get that booster. Really, 3 vaccines are necessary. That wasn't known a year ago. It is known today. Dr. Hurley, he will walk through the additional level of protection. To be clear, the 2 vaccines give you a higher level of protection, but it wanes over time, and there's additional protection. Who wouldn't want additional protection from this deadly virus with the 3rd vaccine? And I highly recommend that people receive it. We currently have 17 0 to 4-year-olds hospitalized with COVID and 8 5 to 17-year-olds. 0 of the 5 to 17-year-olds hospitalized for COVID are vaccinated. So I want to make sure parents know that they can essentially make the chance of their child having to go to the hospital or dying from COVID very close to 0, essentially 0. There's no kids hospitalized who've been vaccinated, and yet there are 8 unvaccinated kids who are hospitalized. While many kids do not suffer severe consequences of the virus, some do, even perfectly healthy kids. And so it's a very good step for parents to take to get your kid vaccinated. We were proud to get our 10-year-old and our 7-year-old fully vaccinated, and I encourage my fellow parents in Colorado to do the same. Last week, we identified our first 2 cases of the Omicron variant in Colorado, making us the 3rd state to detect that variant in our state. I want to thank the state lab and CDPHE and all the folks. We have one of the highest surveillance rates of variants of any state. We're in the top 10. And we also have surveillance over sewage data to let us know what variants are around. Dr. Hurley, he will update us on that. Early data indicates that the variant may be more transmissible than previous strains, but we simply don't know. So I know that in the next week or 2, there'll be a lot of data coming out of Africa on the epidemiological differences between the Omicron variant and the Delta variant. Right now, my fellow Coloradans should know it is the Delta variant that is the primary threat to our health, to our welfare. It is the Delta variant that has caused 417 Coloradans to be in the hospital. It is the Delta variant that is taking Coloradans from us before their time every single day. With that, we'll turn it over to Dr. Hurley.
Thank you, Governor. Good afternoon. So I want to share a little bit about what we've learned so far about the Omicron variant. So as the governor mentioned, we see that this variant is spreading more quickly than Delta did in South Africa. At this point, it's really unclear if this is due to inherent features of the virus that allow it to spread more easily from person to person, or if this is due to more due to human immune system factors. There is some limited data showing higher risk of reinfection with Omicron than earlier variants. With regard to severity, early data is reassuring so far. Hospitalization rates in South Africa do not appear to be higher than expected for the current caseload that is being seen in South Africa. In addition, clinicians have anecdotally reported many hospitalized patients have not required oxygen and are generally less ill than during previous phases of the pandemic. At this point, we really do need more definitive data and studies, and we do expect those over the next 2 weeks or so. But this is some promising data with at least regard to the severity features of the virus. Currently in Colorado, we're holding steady with 2 confirmed Omicron cases in the state. Both of those cases had international travel. And for the first time, our wastewater surveillance system has picked up some of the signature mutations of the Omicron variant. That detection occurred in Boulder's municipal wastewater system. And we are incredibly grateful to Boulder and all water utility systems across the state that are participating in this voluntary system. This is obviously not because we believe that more transmission is occurring here in Colorado than other parts of the country. We do believe that we have a very robust surveillance system here, both our clinical testing that's happening as well as our wastewater surveillance systems. We're unable to quantify how many cases that detection in the Boulder municipal wastewater system represents, but we believe it's likely more than one case, probably some low level of community transmission. And so our recommendation to Boulder residents and to all Coloradans is to keep doing the things that you have been doing. Get vaccinated, get boosted, wear a mask, preferably a surgical or medical grade mask, limit gatherings, and physically distance. It is also more important than ever to get tested if you have symptoms or you've had an exposure. Our detection systems only work when people get tested, and PCR is the preferred test to support these detection systems. Rapid tests are great screening tools, and they are convenient, and an important part of our surveillance system as well. But they are not the tool that we can use to detect changes in the whole genome sequence of these variants like Omicron. So again, preference is for PCR testing to be able to have a fuller picture of transmission of Omicron in the state. All right. So moving on to the slides, as a reminder, here's what we are currently doing in Colorado to track and respond to the Omicron variant. As the governor mentioned, Colorado is one of the top tiers of states for overall COVID-19 sequencing that is occurring. So over 15% of all Colorado cases are sequenced. Our position compared to other states across the country is shown in the map on the right. So again, you can see the darker color means more sequencing is occurring. And again, Colorado has some of the highest sequencing rates in the country. Certainly something that we are proud of. We also have a robust wastewater surveillance system. This is the system, of course, that was able to detect this low level of transmission that we believe could potentially be occurring in Boulder County now. And we have also implemented enhanced case investigation and contacting strategies. And finally, traveler monitoring is something that we have also enhanced in the recent weeks. Next slide, please. So as I mentioned earlier, one of the most important things Coloradans can do right now is to ensure their immune systems are prepared to encounter Omicron or Delta or honestly any variant that might be circulating in the state. And the best way to do that is to get vaccinated if you aren't already. And that, of course, includes children 5 to 11 who are newly eligible for vaccine. If you are a fully vaccinated adult, get your booster now. We are starting to see the clear impact of booster doses in protecting people. This figure shows you the risk of becoming a COVID-19 case between unvaccinated people, fully vaccinated people, and fully vaccinated people who have received a booster dose. So you can see the unvaccinated individuals, their case rate is shown in green. For individuals that are fully vaccinated but without a booster, that case rate is shown in blue. And then fully vaccinated individuals who have received a booster dose, that is shown in purple. So overall, people who have received boosters are 2.4 times less likely to be a COVID-19 case than vaccinated, and 9.7 times less likely to be a COVID-19 case than unvaccinated people. Next slide, please. This is similar data, but showing you these data for hospitalizations. People who have received boosters are 3.3 times less likely to be hospitalized with COVID-19 than vaccinated people, and a pretty significantly large 47.5 times less likely to be a COVID-19 case than unvaccinated people. Thank you.
I just want you to look at this stark data. I mean, if you're out there and you haven't yet been vaccinated, really just look at that enormous difference it makes. I mean, it can reduce your risk 10 to 15 fold getting vaccinated, and that's how we get on with our lives and get back to normal. So, and one of the reasons that the peak of the Delta wave was not as high here as it was in many states that had lower vaccination rates is because Colorado has a higher vaccination rate. It's very simple math. If you're skeptical of the vaccine, just look at the very simple math and you'll see that it's an overwhelming case. I mean, we're not just, advising you to do something that, cuts your risk in half or marginally reduces it. I mean, you reduce your risk 10 to 15 times. What's remarkable is essentially no one who's young and healthy has died of COVID in the Delta wave who's been fully vaccinated. We still do, it still can be fatal for some older, more vulnerable people, to be clear, but it also significantly reduces their likelihood of hospitalization and death if they've gotten vaccinated and boosted. And I'm proud that more than 41% of eligible Coloradans in Colorado got their booster. I'm going to tell you how you can do it. Many people are, do it at their local pharmacy, but there are some areas of the state where you might be a week out before you can get an appointment. So I want to give you the large-scale drive-through and stop-in and no appointment necessary sites that make it very easy to get your booster or your kids vaccinated. They have all of the vaccines at these sites. So if you have a 7-year-old and you need your booster and grandma needs her booster, you can all go and get it. We're at Arapahoe Community College 7 days a week. 10 a.m. to 6 p.m. That's 5900 South Santa Fe Drive, Littleton. The Aurora Municipal Center has a drive-in, 15151 East Alameda Parkway. That one is a Monday to Saturday, 9 a.m. to 6 p.m. Chapel Hills Mall in Colorado Springs, 7 days a week, 10 a.m. to 5:30 p.m. Citadel Mall next to JCPenney in Colorado Springs at 680 Citadel Drive East, 10 a.m. to 6 p.m. Monday through Saturday. Douglas County Fairgrounds in Castle Rock, and that is Monday through Saturday, 10 a.m. to 5 p.m., and Sunday, 11 to 4. In Littleton, Jefferson Marketplace, Tuesday through Sunday, 9 a.m. to 6:45 p.m. In Durango, La Plata County Fairgrounds, 9 a.m. to 3:30 p.m., Monday through Saturday. In Pueblo, Pueblo Mall, 3201 Dillon Drive, Tuesday through Sunday, 10 a.m. to 5 p.m., and in Greeley, Weld County Clerk and Recorder Building, Tuesday, Thursday, and Friday, 8:30 to 6, and more limited hours on Wednesday and Saturday. You can set up appointments on these, and I clicked on some. They all have appointments available tomorrow, this weekend. You can also show up, and most of the time you get seen right away. If you're showing up right around the time work gets out at the end of the day or work starts, there is sometimes a line, but you can avoid that by just clicking online and setting up an appointment. There are plenty of appointments available. For your kids to get a vaccine, for you to get a booster, and for those of you who haven't yet gotten the first vaccine, of course, that's the priority. That makes the single biggest difference for the state. Coloradans can view the full list of clinics and times, other mobile vaccination clinic sites at covid19.colorado.gov/vaccine. So while the pharmacies are delivering the majority of them, we know that some are backed up a week or two, and we want it to be available to you today. So if you need that booster, you'll have that protection by Christmas, right? So go ahead and get it this week, this weekend at any of those drive-through sites. You can set up an appointment, or you can show up without an appointment, and you should be seen relatively soon. But to be sure you don't have to wait, go ahead and set up an appointment. There's plenty available. The nature of this virus brings a lot of uncertainty with it. But one thing we know is that boosters reduce the spread of COVID-19 and prevent serious illness and hospitalization, especially with all the uncertainty around the Omicron variant, the continued strength of the Delta variant in Colorado. It's time to roll up our arms and get boosted. For centuries, medical professionals have discovered new and effective remedies for various ailments. There's penicillin that revolutionized medicine as we know it, the way that aspirin can alleviate headaches. And the COVID-19 vaccine, formulated with decades of research to back up the new methodology, prevents COVID-19 hospitalizations and deaths. For those who contract COVID, we also have highly effective monoclonal antibody treatment available. We have far more availability than demand, which means it's available to you. And you can simply sign up to get it. And that is, again, when you contract COVID and you have mild to moderate symptoms, and you're at a higher risk, meaning you're in your 60s and 70s, or you're younger than that but have a pre-existing condition, you are an excellent, or you could be an excellent candidate for monoclonal antibody treatment, which in turn can reduce your hospitalization risk by 70%. So, right, not as effective as the vaccine, over 90%, but still, who wouldn't want to reduce the risk of having to go to the hospital by 3/4? So if you recently got diagnosed, it's important therapy. And I want to make sure that people know it's too late once you need to be hospitalized for COVID to get the monoclonal treatment. They have other treatments, but at that point, you're already in a severe health situation. So you get it early in your diagnosis before you're in need of hospitalization, and monoclonal treatments are widely available, many sites across the state, including mobile buses. And you can go to covid19.colorado.gov to find out more. To everyone who's done their part, thank you. To those who've been standing by, it's time for you to step up and get protected. If not for yourself, do it to protect those who you love most. Do it to protect our way of life in the great state of Colorado. With that, I'm happy to take some questions.
I don't have. You don't have one? Okay.
We'll come back to you.
Governor,
Good to see you.
Pull these out. Good to see you. Yesterday, we talked to a CEO of a nonprofit in Commerce City who talked about the CDPHE canceling their clinic on Saturday. We heard from another, the public health director in Steamboat Springs today, saying that they almost had a clinic cancellation for an equity clinic there. What are you doing to ensure that this vaccine is getting in the arms of these underserved communities that actually need it and may have trust issues with it?
Yeah, and as you know, we've had an equity focus from the start. In fact, we've done several dozen clinics successfully with Adelante. We've done a number of other equity clinics across the state. What happened in that case is the staff called in sick, and we want to make sure that when people go to get vaccinated, they're not exposed to COVID, of course, but also not to a flu or a cold. And with hundreds of successful clinics across the state, and the tight workforce issues we have, it shouldn't be shocking that there might be a time or two where people call in sick. What we're working on doing is developing a reserve of flexible workforce that if staff calls in sick for a particular site, we could then send in that staff to make sure that it's fully staffed. So we hope that that can narrow the gap and prevent this need for any additional clinics to be canceled. But everybody's trying their best. The workforce is stretched thin. We need qualified people to do this work. Not just anybody can administer a shot. They need to be qualified and certified. And we want to make sure that people have confidence that the people that are giving them shots are not themselves sick or infectious.
Could you use the volunteer reserve that I know CDPHE has set up of medical professionals who say they're willing to jump in and volunteer in a situation like that?
As long as they're qualified. We need several different folks there. We need folks who mix the vaccine, the pharmacologists. We need the folks who administer the vaccine. They can be they don't need to be a full nurse. They can be a phlebotomist. They need that qualification. But yes, we can use folks who qualify and have active certification and training for the proper task. And we are working on that reserve pool to be able to fill in if people at a particular location call in sick and can't attend, keeping in mind that we'll have to move quickly because that can occur a day before, 12 hours before. And we want to have the ability to augment the staff to prevent or at least significantly reduce the need for additional cancellations.
Hi, Governor. This is Patty Nyberg with the Associated Press. Today, a federal judge in Georgia announced a preliminary injunction temporarily blocking the Biden administration from enforcing its vaccine mandate for federal contractors. I'm wondering if you have any comments on the injunction and what this means for federal contractors in the state.
I have not seen that yet, so I don't have any particular comment on it. Of course, Colorado will follow the law, will follow the decisions of the relevant courts of jurisdiction. So whatever the courts find, of course, Colorado will follow those rules for federal contractors.
Hello, this is Meg Wingeter from the Denver Post. My question is for Dr. Herlihy. When you say about limited community spread in Boulder, I know you said you can't specific numbers, but how should people understand that or think of that? And my other question is with seeing hospitalizations ticking back up a bit these last couple days, can you say if we're plateauing or what exactly might be going on there?
Yeah, so to your first question, the wastewater surveillance systems are really designed more to be plus minus systems, so detected, not detected systems. We can infer a little bit when there's high versus low levels of detection, but in general, we're not really capable of quantifying specifically how much, so how many individuals that might represent. Our feeling at this point is it's probably a very low level of circulation, a low level of community transmission that could potentially be occurring in Boulder. We're obviously going to be looking closely at additional specimens that come in from patients that seek testing in Boulder County to see if we can have detections through our routine clinical testing program. So that's the next step to see if we identify transmission that way. To your second question about the increase in hospitalizations that we've seen in the last couple of days. So that's a trend that I'm watching very closely. I think it's difficult to know right now if this is a short-term trend that we have seen similarly after other holidays, if we might potentially see this increase occur for a few days, representing increased gathering, changes in contacts that occurred over the Thanksgiving holiday. You might notice that our cases bounced up a little bit as well. But otherwise, we really don't know for certain what might be happening. We're certainly hoping that the numbers will turn a corner and go back down again. That's what we'll be paying attention for and watching closely over the next couple of days.
Dr. Hurley, and I guess maybe Governor, besides the wastewater case of Omicron, have there been other confirmed cases in Colorado? And then I guess secondarily, can you provide an update on the state's efforts to build out the hospital capacity? Are we still on track to have those 500 beds, I think, by December 21st or whatever the date is?
Yeah, so the fact that it's been picked up in the wastewater in Boulder indicates that it could be the person that's already known in Boulder, or it could be additional people, a small number. Because we are sequencing over 15% of all the tests administered in the state and have not yet identified another case, I assume we will at some point, we know that there's not a high level of transmission, or it will be showing up because we are sequencing over 15% of all the testing being done. Happy to get you an update on that. I didn't come with it here today on the hospital piece, but we will provide you with that.
In Spanish, I'm sorry, Governor. Si podría nuevamente repetir el update de la semana pasada a esta semana, cómo ha mejorado, ha empeorado para los televidentes de habla hispana.
¿Otra vez, por favor?
Si podría repetir nuevamente lo del principio que mencionó el update de last week a esta semana.
Más corto.
Si nos puede dar un upgrade de la semana pasada a esta para la gente que habla español.
En un minuto. Or so. Okay. Todavía hay mucho COVID-19 en nuestro estado, pero las vacunas son muy efectivas para prevenir hospitalizaciones y también mortandades. Ya tenemos 2 personas que tienen el variante Omicron. Y todavía no sabemos mucho sobre este variante, pero ahora mismo los cientistas creen que los vacunos están muy efectivos contra todos los variantes Delta y Omicron también. Es muy fácil recibir su vacuna, y también si ya recibieron sus vacunas, debe recibir el booster después de 6 meses después del segundo vacuna, y es gratis, y es en su farmacia local, supermercado. También hay centros grandes para recibirlo también.
Hi, Governor Seth from the Gazette. This is probably a question for Dr. Hurley. Dr. Hurley, can you speak to the impact monoclonal antibodies are having on hospitalizations for COVID, and if the state is continuing to ramp that up and how it's going to do that? Thanks.
Yes, absolutely. So we know from a number of scientific studies that have been done that monoclonal antibodies can really have a significant impact in decreasing an individual's risk of hospitalization. We know that that level of protection is probably 70 to 80% decrease in risk of hospitalization. So we certainly believe that for those Coloradans that are receiving monoclonal antibodies, that they are seeing significant protection. That's obviously very important right now while our hospitalization numbers are high and our healthcare system is strained, that individuals who qualify for this life-saving treatment receive this treatment. It's needed not just for individual level protection, but also to protect our overall healthcare capacity.
One for Dr. Hurley again. Do you know where we stand on disparities in vaccines in Colorado, like when it comes to getting the vaccine to underserved population?
Sure, I would have to get back to you on those statistics. Sorry.
I am proud of our tracking. We do have. We were in the forefront. We were getting a lot of non-reports back. We really want to value this geographic data, racial data. So we have all that, and we'll be sharing that with you.
Hello, Governor. I'm Jesus Carrasquel from Noticias Univisión Colorado.
Hola.
Gobernador, si nos puede responder en español, han surgido ciertas quejas sobre la cancelación de una jornada de vacunación para hispanos de la organización Adelante Community. ¿Podría decirnos, por favor, qué ocurrió en esta situación y si está garantizando de que lleguen las vacunas a las comunidades hispanas?
Sí, quiero decir lo siento porque los médicos eran enferma antes de esta clínica y esta es la razón que lo cancelamos porque es muy importante que los médicos su propia no están enferma. Vamos a citar una cita nueva para esto y tengo muchas clínicas durante todo el estado, incluido mucho para las minoridades y para la comunidad latina y queremos juntar con adelante para más clínicas también.
Hello, Governor Polis. This is Vinny Del Giudice at Bloomberg News in Denver. First of all, thank you to you and Dr. Hurley for these regular briefings for almost 2 years now. Questions on COVID-19 hospitalizations and post-pandemic economy in the state. How is staffing holding up? I know you mentioned you're going to be adding the 500 beds. You don't have that right now. But are the hospitals still fragile? Are you still at a point where you could push more crisis standards of care out the door? And as far as the economy, post-pandemic inflation all over the country is heating up. What is the price inflation outlook, the cost of living outlook for Coloradans at this point? Thank you very much.
Thanks, Vinny. So we've been in the 90 to 95% range of hospital capacity for several weeks now, which means we're not exceeding hospital capacity, but it's perilously close, and we watch that every day, and that's why we have worked to add some additional capacity there. And what's important is that we're able to treat people who have heart attacks, strokes, car accidents. To put things in perspective, the COVID hospitalizations are only about 15 to 20% of the total hospitalizations, at times up to 25% in the last few weeks too, but let's say 15 to 25%. But that is usually the margin that the hospitals have, because they're often in that 80 to 85% range, 75, 85, and then if there's an outbreak of flu or there's a 50-car pileup and the need for a lot of to be hospitalized, that's that extra room that they have. So it is very close when we're in that 99 to 95% range. It is very important we don't exceed that capacity. That's why we're working on additional capacity. That's also why we've are rapidly rolling out the monoclonal. We want that to be available to anybody who's at risk, who contracts COVID, because that alone can reduce hospitalization rate by about 70%. So that's where that is. What was your second question about the economy? Vinny,
Yes, sir. Yes, sir. The post-pandemic economy, we're seeing prices take off, inflation take off throughout the country. What is the outlook for the cost of living in the state and for Colorado families? Thank you very much.
So our budget proposes reducing fees, reducing costs, saving Coloradans money, whether it's as simple as the property tax cut that we already implemented with the legislature, reducing fees for renewal of different licenses, doing everything we can to save Coloradans money on housing, on healthcare, on different state fees. So reducing payroll taxes, reducing fees can help Coloradans get by, and we want to make sure that we're doing everything we can to meet Coloradans where they are and helping them thrive in the economy over the next few years.
Dr. Hurley, I think this is a question for you, but regarding the vaccine booster data that we have so far, can you talk about how confident you are that that really reflects, the broader population, since not a ton of people have gotten boosters thus far? Do you think those numbers are going to change at all, or are you confident that that kind of reflects the real protection for everybody?
Yeah, that's a great question. So last week, actually, I was asked the question about that data, and we've been waiting to have confidence in that data. So the challenge is we needed enough hospitalizations to occur, enough cases to occur for us to feel confident that we had a large enough data set to confidently analyze. So I do feel pretty good about the data that we have at this point. One important thing to keep in mind, though, is that booster doses early on were primarily given to individuals who were immunocompromised, that third dose. And it's really difficult with our data systems to tease apart the immunocompromised individuals versus other individuals. And so as time goes on and we gather more and more individuals that have received a true booster versus a third dose because they're immunocompromised, we might actually see that gap grow even more, meaning seeing a clearer effect size from the booster doses.
So, and I just want to also what she said was very good. I want to translate that a little to make sure you got it. So we already see the effect, even though there are some immunocompromised in that booster group. In fact, a disproportionate amount of immunocompromised, but there's still a difference in all of our data between boosted and non-boosted, quite a big difference. What she said she's expecting is that difference will grow as the immunocompromised represent a lower and lower percentage of those who are boosted. So we already see it, and it's only going to get bigger based on that trend. Any final questions? Thank you all. What's that? What are you pointing at? Thank you all very much. Thank you.